Welcome to the family. We are so honored that you have chosen our office for your orthodontic treatment. Our goal is to partner with you to give you the best smile possible. We know that you may have several questions about your braces and how to properly care for them. This video is to help inform you about everything you need to know throughout your treatment. We have several ways to connect with our patients. Check out our website and social media sites like Facebook, Instagram, Twitter, and Pinterest to find out about upcoming contests, promotions, and office events.
Hello, I'm Dr. Callahan, and I'm here to give you a brief overview of what we just placed on your teeth. There are several components to braces, as you can probably tell. The first component is the bracket, and that's what's actually physically glued to your tooth. And you'll notice that all the brackets have a little bit of a different shape. Even some of them have little hooks on the end that we'll use actually with elastics to get your bite straightened in the end. So we got the bracket that actually is glued to your tooth, but you'll also notice that there's a wire that connects those brackets together. That's what we call an arch wire. Now that wire has to be connected to those brackets. In order to do so, we use special ties to actually hold the wire into the bracket. Those ties can either be made of metal, which we call a steel tie, or they can be made of elastic, which has the really cool colors that you can get. And you get to change those out every time you come in. So have fun with those, and I'm going to send it back to Max.
Now that you know what's in your mouth, let's talk about how to take care of your teeth and braces.
One of the more important aspects of achieving your best smile is to maintain excellent oral hygiene throughout treatment to reduce the risk of white spots or damage to your teeth. Keep in mind that the type of toothbrush you use is not as important as how you use it. You can use either an electric toothbrush or a traditional soft bristle toothbrush like this one. You may notice that if you continue to brush your teeth the same way you did before your braces were placed, that you may miss areas. It is important to angle your toothbrush, allowing the bristles to reach under the wire and around the brackets. Remember to brush all surfaces of the teeth as well as the tongue. It is also important to floss every day. You may also notice that this will be more challenging with the wires and brackets, but we will show you a few ways that will make this easier. One way to floss is by dropping the floss behind the wire and pulling through, flossing in a C motion on both sides of the teeth like this. If this is too difficult, try using floss threaders. There are many different products that are available to help. Some of these are Superfloss and Water Picks. Some other tips that can help you keep your teeth and gums healthy during treatment are to use a fluoride rinse daily and to get a handheld mirror to double check and make sure all areas have been cleaned thoroughly. Most important, remember to continue to see your dentist for regular cleanings and checkups.
You've just gotten your braces and you're probably wondering what you can and can't have to eat. Let's go inside and we'll go shop.
We still want you to eat your fruits and vegetables. It's just important to make sure cut them up into smaller pieces and chew them on your back teeth so that you don't have any brackets come loose.
Apples are my favorite, but just remember, don't bite straight into it. It's okay to still enjoy some of your favorite foods like potato chips. Just try the ones that aren't as hard and crunchy, say like Pringles. Some of the hard and crunchy ones you may want to avoid are the Tostito chips and also pork skins, the hard and crunchy ones. Some more foods that you want to stay away from: nuts and popcorn. They can get stuck in between the brackets and also cause you to break wires and your brackets. It's okay to occasionally enjoy your favorite soft drink. Just be aware of hidden sugars that can be found in sports drinks and energy drinks, and also any fruit juices that you may drink. When available, always try to brush your teeth after, but if not, at least rinse out with some water to get rid of the sugars on your teeth. We have a lot of questions about can gum be chewed with braces. Even the sugarless kind, we would prefer that you not chew because it can shift your wire around and cause you to be in treatment even longer. Also, the sticky, crunchy, chewy candies like Skittles or Snickers, we would prefer that you not eat. I know you may be giving up a few of your favorite foods, but in the end, it will be worth it for the beautiful smile you will have that lasts forever.
Now you may be wondering what to do if something breaks or is uncomfortable. Let's cover some of the most common emergencies.
Sometimes during treatment, you may have a bracket come loose or a wire poke. This can come from the food you eat, chewing on objects like pens, or by getting hit in the mouth when playing sports. Another way to protect your braces and teeth is by using a mouth guard. When selecting a mouth guard, you can use any brand as long as you don't mold it to your teeth, since they will be continually changing. During treatment, a bracket may come loose. If you are not in any discomfort, this can wait to be fixed, but always call our office and let us know so that we can give you proper instructions. If you have a long span of wire in between brackets and the wire comes loose, you can attempt to reinsert the wire with tweezers. Wire pokes can be uncomfortable. If possible, use an eraser to push in any sharp wires or use wax to cover the area that is uncomfortable. If a wire is poking in the back of the mouth, you can trim the wire with a small wire cutter. If an elastic tie comes off, this is not an emergency and can wait to be replaced at your next appointment.
Well, hello, I'm Dr. Ed Shehee, and by this point, watching our video, you've already been introduced to braces and have been shown a few of the parts. So one of the questions that folks want to know is, does this hurt? How much pain am I going to be in? So I think we should expect a couple of things. What we've learned over the years is that when we first put the braces on, there's going to be some scratchiness or roughness because of the braces or the wires. It's going to rub the cheek and the tissues around the teeth. That tissue is very thin, but it has a way of thickening or healing very quickly. It almost forms a callus. So we use the wax that we've talked about to kind of help put over any sharp, rough edges, and in a matter of 2 or 3 days, typically that tissue will have responded to the point that that's not an issue for you. The other thing is that the way we move the teeth is we apply pressure to the teeth, and the tooth sits in a bone socket, and that pressure causes little swelling around the root of the tooth, so that anytime at that point after we've started that there's pressure on the tooth to bite or chew or to bump into anything, it can be sore or tender. So we would recommend that you use some sort of anti-inflammatory over-the-counter medication like Advil, so that helps with the discomfort, but also it helps reduce the swelling. So I hope that gives you an idea of what to expect. It's going to be a little uncomfortable the first few days. If you can get through that, it should be smooth sailing after that. So good luck with your orthodontic venture.
If you have any questions or concerns, we want to know, and we are always available for you nights and weekends. After office hours, there will be an emergency number on our answering machine. Our main concern is that you experience the least amount of discomfort possible while you are in treatment with us. We've covered a lot of information, but just remember, we are here for you. So if you have any questions or concerns, please give us a call and we will do our best to provide you with the information that you need. We are so happy having you as part of our family and serving you with a smile.